I'm Jeanette, the nurse educator for Parkside OB-GYN. We're getting closer and closer to the start of flu season, so let's talk about why this matters for all of our expectant parents. Pregnancy affects your entire body. This can change the way your body reacts to the flu virus, which places you at a higher risk of complications from the flu, not just during pregnancy, but also up to 2 weeks postpartum. So let's talk about why this is recommended. First, pregnancy weakens the body's immune system. That makes you more susceptible to getting sick and to having complications from getting sick. Also, babies' immune systems are very immature and they're very vulnerable to the flu until they can be vaccinated themselves at 6 months of age. On top of that, your blood volume is increased, meaning you have more of it flowing through your body, putting more work on your heart and your lungs. We know viruses like influenza and COVID can also affect our heart and lungs, so this is just adding more risk of complications on top of the weakened immune system. So now let's explore some important facts about the flu and the flu vaccine. First and foremost, flu shots are safe while pregnant and breastfeeding and is the recommendation of the CDC, ACOG, and your Parkside OB-GYN providers. And while the flu vaccine may not completely eliminate the risk of getting the flu during flu season, it drastically reduces your risk of complications and hospitalization if you do get sick. Also, the antibodies your body produces in reaction to the vaccine, they pass through the placenta to your baby, and they're also present in your breast milk if you decide to breastfeed. This offers your baby some protection during this very vulnerable time because babies can't be vaccinated with the flu vaccine themselves until after 6 months of age. Let's also debunk the common myth of the flu shot making you sick. The flu shot does not contain any active flu virus. So getting the flu vaccine does not give you the flu nor make you more likely to get the flu. And usually side effects to the flu vaccine are pretty mild. You might notice redness or soreness at the injection site, and some people will have headaches, muscle aches, fever, nausea, fatigue, and usually those side effects, like I said, are mild and they go away within just a couple of days. Flu season itself is typically somewhere between October to April, but cases still occur earlier and later than that. So, because of this, it's recommended that pregnant people receive the flu vaccine as early in the season as possible, in late August or early September if it's available. Our office will let you know when we begin offering this flu vaccine. We also strongly encourage other adults who will come into contact with your baby, especially other caregivers, to get the flu vaccine as well. And we can give your partner theirs when you get your vaccine if needed. It's always your choice whether you decide to get the flu vaccine or not. If you decide not to take it, be sure to take measures to protect yourself in public. Wear a mask, wash your hands often, avoid touching your face, and don't eat or drink after other people. Thank you so much for taking time to learn more about why we recommend getting the flu vaccine when you're pregnant. Remember, this is general education, and it's intended to help Parkside OB-GYN patients make informed decisions. It's not intended to replace the advice and guidance of your healthcare providers.